Welcome back to Twin Cities Live. So, we talk to a lot of doctors on this show about how to decrease your risk of disease. We want to help you live a long, healthy life. Well, today we're focusing on something really exciting. So, it's genetic testing that's offered at no cost, and it gives you valuable information and then also helps researchers learn more about the genetic health risks of our community as a whole.
So, it's called myGenetics. How about that? It's a new research program from HealthPartners. So, here's what it tests for: 3 genetic markers: hereditary breast and ovarian cancer, a specific hereditary colorectal cancer, and a hereditary high cholesterol marker as well. Plus, it'll give you information about your regional ancestry and some other fun genetic traits.
All right, let's find out more about how it works. Okay, Dina, I'm really excited to talk to you about this because I have gone through this testing too, and I feel like the more information we have about our bodies is better. Is that how you were feeling? What was your motivation?
My motivation was what you just said, getting that information and knowing that I thought that there was something there and not being able to prove it. So for me, it was a fact-finding mission.
Tell me what you were expecting and then the information that you received.
Realistically, I was expecting that my results would be what they were. I knew that there was something out there. I didn't have the medical expertise to prove it. So when I saw that I could get this testing, it was a done deal. It was already done. And once I got the results, it actually brought me a sense of relief.
The testing is simple. Just enroll online, pick a clinic near you, and go in for a quick blood draw. The appointment took me less than 10 minutes, and the results show up in your email inbox, ready for you to share with your healthcare provider.
We used to relatively limit how we talk to patients about getting testing done, so that only if you had a strong family history or if you had other cancers should you be looking into this testing. But now we know that up to 25% of women with ovarian cancer will have a genetic predisposition, even though they don't have a strong family history. So programs like myGenetics has already started changing what the outcomes for patients with cancer can be. So one that comes to mind is a woman who had genetic testing done, and this patient actually had a history of breast cancer. So the myGenetics test came back positive for a mutation in a gene called the BRCA2 gene. Patients who have a mutation in that gene are at increased risk of developing particularly breast and ovarian cancer. She underwent a preventative removal of her ovaries and fallopian tubes. We found a cancer in her fallopian tube at an early stage so that she could be cured from it. And she's one of now at least 5 to 7 patients that I've taken care of at HealthPartners since myGenetics has started, where the patients were getting the testing done just because they joined this program. And now this program has, without question, saved their life. Most of the time, advanced ovarian cancer is not diagnosed until it's at a point where it's very difficult to cure. If we can diagnose patients in early stage, which myGenetics allows us to do, we can cure patients for whom a cure would have been a very low likelihood in the past.
And those are the kind of stories I think that are so motivating for people who might think, well, I'm afraid to know. Some of us want to put the blinders on and be like, I don't want to know.
And I think a lot of that is because we're thinking about ovarian cancer as it was in the past, where, yes, most of the time it's diagnosed at an advanced stage. What you'd be learning is something that's likely going to help us find it at a much earlier stage. The genetic testing that we're doing is to identify a problem that we can then do an intervention for.
Just like Dr. Downs' patient, Dina's results also came back BRCA2 positive.
I immediately started reading the information that was provided to me in the results for myGenetics, and it was everything that I needed to know. It was really helpful. It helped me to figure out what my next questions were going to be, who my next doctor visits were going to be, what I needed to tell my family, what other appointments needed to be scheduled. And ultimately, I elected for the safer option for me, which was the total hysterectomy and the double mastectomy.
Wow. How are you feeling now?
Fabulous. I couldn't feel better. I do. I feel amazing. There's not a day that goes by that I'm not grateful for my decision.
The testing that we're doing now can make an impact for cancers that have a large impact on women's quality of life and their survival.
Okay, I'm fascinated by this for
So
a lot of different
interesting.
reasons,
Yeah.
but I just want to put it out there too that, you know, to have the peace of mind to know that you may have these things, you may
Right.
carry them,
Right.
or on the other side, you don't have these
Well, and
things.
Dina said she was always waiting for the other shoe to drop. She was just like waiting for
Right.
at some point when she was going to get a diagnosis, and now she feels so empowered because of her family history. So she feels really empowered and like she can move forward.
Right, and I know so many people that may have something. It doesn't have to be a serious condition. They're like, oh no, it's genetic, it's passed down. Like, not always.
No.
Not always, because
Yeah.
it doesn't always go from person to person within the same family. So I also want to ask, like, the other things that you can get.
You get really cool information like regional ancestry, plus traits like caffeine sensitivity, sweet tooth, hair curl, see all these here, earwax type,
What?
and your circadian rhythm. And a lot of people have asked me, okay, what about the security of this? Are you
Yes.
nervous about your information? So this is not like one of those online genetic companies that can connect you to
There's
long
one that
lost
just filed for bankruptcy
relatives.
that everybody's a little worried about.
This is about health information. So it does not impact your insurance. The testing is no cost, and it is totally private. I did it.
Okay, private, no cost, but then you have to be a member of HealthPartners?
No, you don't.
Oh.
No, it's open to everybody. We've got a link to participate. It is posted on TwinCitiesLive.com.
Good job.
Thank you. Really cool stuff. We'll be back right after this.